Hello and welcome to our presentation on the Tennessee Physical Therapy Dry Needling Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. Dry needling means a skilled intervention that uses a thin, filiform needle to penetrate the skin and stimulate underlying neural, muscular, and connective tissues for the management of neuromusculoskeletal conditions, pain, and movement impairment. In order to perform dry needling, a physical therapist must obtain all educational instruction required. All such educational instruction must be obtained in person and may not be obtained online or through video conferencing. Must obtain at least 50 hours of instruction to include instruction in each of the 4 areas listed below, which are generally satisfied during the normal course of study in physical therapy school: musculoskeletal and neuromuscular systems, anatomical basis of pain mechanisms, chronic pain and referred pain, trigger points, and universal precautions. You'll also need 24 hours of dry needling specific instruction, which will include dry needling technique, dry needling indications and contraindications, documentation of dry needling, management of adverse effects, practical psychomotor competency, and OSHA's bloodborne pathogens protocol. Each instructional course shall specify what anatomical regions are included in the instruction and describe whether the course offers introductory or advanced instruction in dry needling. Each course must be pre-approved or approved by the board or its consultant, or the board may delegate the approval process to recognized health-related organizations or accredited physical therapy educational institutions. Any physical therapist who has obtained the requisite 24 hours of instruction in another state or country must provide the same documentation to the board that is required of a course provider. The board or its consultant must approve the practitioner's dry needling coursework before the physical therapist can practice dry needling in Tennessee. A newly licensed physical therapist shall not practice dry needling for at least 1 year from the date of the initial licensure, unless the practitioner can demonstrate compliance through his or her pre-licensure educational coursework. Dry needling may only be performed by a licensed physical therapist and may not be delegated to an assistant or support personnel. All physical therapy patients receiving dry needling shall be provided with information from the patient's PT that includes a definition and description of the practice of dry needling and a description of the risks, benefits, and potential side effects of dry needling. Physical therapy clinical students who have completed all educational requirements set forth above may practice dry needling under the direct on-site supervision of a physical therapist licensed in Tennessee who has met the educational prerequisites above and practiced for at least 1 year. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.